Good evening, everyone. I am Harsha, representing a group called Science Integra, and I extend a warm welcome to all of you for the 21st episode webinar series called Maha Smiles Cleft Care for Every Child. This event is organized by AMOX in collaboration with Foxy. It's my pleasure to introduce you all to Dr. Charvi, who is the Program Officer of Smile Train India, who will be addressing us. Over to you, Charvi ma'am.
Thank you, Harsha. Good evening, everyone. I am Dr. Charvi from Smile Trend India. Maha Smiles is a flagship CSR initiative by Bajaj Finserv in partnership with Smile Train India. Can we have the slides, please, Harsha? This collaboration is dedicated to create awareness and expanding access to timely and comprehensive cleft care across Maharashtra. So, over the span of 3 years, Maha Smiles aims to enable nearly 8,000 life-changing cleft surgeries for children in need across the state. But Maha Smiles is not just about surgery; it's also about creating awareness on the critical importance of early intervention and ensuring families understand the timelines and milestones in a child's cleft treatment journey from birth through speech therapy, orthodontic treatment, and beyond. So, to make this possible, we are working to build a strong, sustainable referral network, engaging community with health workers, with gynecologists, pediatricians, and frontline workers, so that no child is missed and every child born with a cleft receives care right from the start. Because every smile matters and every child deserves the chance to smile with confidence. So if you know a child born with a cleft lip or palate or a parent seeking help, please refer them to Smile Trend India. They can reach out to us through our toll-free cleft helpline number, and the number is 1800-103-8301. Now I would like to introduce Dr. Supriya. Can I have a CV, please, Harsha?
Sure.
Hello. I think we are fine. I can just go ahead.
Introduce Priya.
I think we'll just go ahead and let me take this opportunity to welcome all of you to this Smile Train webinar, which is an excellent initiative in coordination and collaboration with AMOGS. And at the outset, I would like to thank the AMOGS president, Dr. Kiran Kurtakoti, for allowing this program to continue in his leadership. I also take this opportunity to welcome our very, very special guests for today, Dr. Alka Kriplani, who is also the past president of Foxy, and Dr. Sheila Mane, who is the ICOG chair-elect. And warm welcome to all the dear chairpersons and faculty, Dr. Sujit and Dr. Kadu. Without much ado, we will just go ahead with this webinar, and let me introduce the chief guest for today, Dr. Kiran Kurtakoti. Kiran sir is, like I said, the president of AMOGS. Very out.
Supriya,
Okay.
It's fine. Supriya, it's fine. Thank you. On
I
behalf
try
of
people know me
AMOGS,
by heart,
a
so I
very
can
warm welcome
directly
to
hand
all
over
of
to him.
you.
Yeah, thank you.
My respects to our guests of honor. Really, AMOGS is very pleased to have Professor Kriplani and Dr. Sheila, two people very close to Pune society as well as to AMOGS. So thank you for being here with AMOGS. And really a great venture by Bajaj Finserv. 8,000 surgeries is a phenomenal work that they are doing, and really a big round of applause for them. Actually, I mean, we are just informing people what is to be done, but actually the groundwork and the help is given by people like Bajaj, and of course, thank you, Science Integra. So today, me and Sujit and probably Mahesh are the odd people out. All the other iron ladies are in front of us, and really, it will be a good thing to hear Sujit speaking on imaging in cleft lip and cleft palate, and of course, Dr. Sonal speaking on importance of counseling and community support. Way back when we did our post graduation, probably cleft lip and cleft palate would have resulted in probably termination of pregnancy, the couple opting for termination. But today, this is not the situation. Today, appropriate treatment is available. But of course, because of the proper diagnosis, proper surgical, and of course, the help rendered by people like Bajaj Finserv. So thank you everyone for that. And thank you, Professor Kriplani and Sheila, for joining in this webinar as our guests of honor, and we really look forward to your presence in amongst in the future also, and of course in this webinar also. So thank you so much, and without much ado, Sujit, Supriya, Monica, Preeti, everyone, best wishes to you also for your endeavors in Foxy. I know everyone is contesting some kind of election or the other, so it's all election time, just as it is like in Marathi Lagin Sarai म्हणतात. In Marathi it's Lagin Sarai. So this is election sarai.
Elections
So
are
best
right.
wishes to all of you also. And I'm sure that Dr. Sheila Mane madam and Kriplani madam will keep us amongst in their blessings also and their prayers also. Thank you so much. Madam Kriplani, आप जरूर कभी पुणे में आइए. And we remember still the JC conference where you had played a fantastic role also as an orator and also as Krishna when Dr. Bharti Dore Patil had organized it. So we still have all those pictures. Okay. And of course, Sheila is our very own lady from Vidarbha and म्हणजे आमचा घरचीच व्यक्ती आहे. Although she is now settled in Karnataka, she is our own. We consider her as our own Amongstian. So thank you for being here and my best wishes. And please carry on with the program.
Thank you so much, Dr. Kiran. That was a very loving message. And thank you for your continued support. And we hope to carry on Smile Train for many more episodes to come. It's now time to invite our really, really special guest for today, Dr. Professor Alka Kripnali, ma'am. Ma'am, thank you so much for doing us the honor of joining us on this platform. And as I already mentioned to you, Smile Train is, what an endeavor to bring smiles back to young children with cleft lip, cleft palate. It's a wonderful social initiative that has been going on for years now, and it's an honor for AMOX to be associated with it. And I now request Alka ma'am to please give us her pearls of wisdom.
Thank you so much, Dr. Supriya, for your sweet words. Let me confess my ignorance. I didn't know this smile thing is going on for years and they are doing such great work. So I really appreciate these people with such good thought and CRS activity, and so many 8,000 have been benefited. So I salute them, and I wish somebody takes this uh, at a what is nowadays this is very common, this dyslexia and these things. So many parents, poor parents, run from pillar to post. They need to be, such an initiative should be there. But whatever someone is doing, we salute them. And what to say of you lovely young girl Supriya Anwari, who is constantly communicating with me, Monica, Priya. And see, it is not that just our Amox president said that election time. I think it is an opportunity. हम सब मजबूरी में ही काम करते हैं. Even election के लिए तो हम टच में तो आ रहे हैं एक दूसरे के. I can see you people bubbling with energy and willing to do such good work and communicating with each and every person and joining all Foxians. It's a great job. I wish you girl all the best and I wish you come and for 3 years for adolescent committee you do great work. And this is an initiative. As I said, this dyslexia and these things are so common nowadays. And when you people come, you should take initiative to have more CRS with such a meaningful activity that it is actually benefiting the people who
Yes,
need it. So it's a great thing. I wish you all the best And these topics are also so well chosen. So wish you all the best in all aspects.
Thank you. Thank you so much, ma'am, for your blessings. And definitely, we are going to carry forward this, even the Smile Train activity to other societies of OPSI other than AMOG's member societies also. So that is definitely there on the cards. And thank you so much for taking your precious time out and coming and joining us on.
Pleasure.
Ma'am,
All the
I would like to hand over to Dr. Monica. Thank you, ma'am.
I can just
Monica, in spite of being busy, has joined in. She's very, very busy with her, wedding and so many things at home. But still, she took out the time to join us. So, Monica, over to you to invite our next guest of honor.
before Monica starts, can I just say something? Ma'am, Kriplani madam, what you mentioned about dyslexia, in fact, as a part of the Mumbai Isopap series that we have started doing, Monica and Supriya are again a part of that series with me. We actually did one program, madam, on the World Down Syndrome Day. And that day we had invited Dr. Neelam Sodhi from Ludhiana. And she's in fact doing a lot of work, madam, for trying to spread awareness for specially abled children and ADHD, Down syndrome, dyslexia. So I think, madam, what you suggested is really, really good. And I think we all need to maybe do more of those programs and try and spread the awareness. I mean, it was a very big eye opener, her presentation, that it actually changed the outlook of everybody who was there at that time. I mean, I think we need to have more of those programs. I would agree with you, madam.
Monica, I really appreciate your attentiveness and your involvement in these things. And I wish you also all the best.
Yeah, Preeti, madam.
Thank you. Ma'am, I am Monica and she's Preeti. I have been working for Public Awareness Committee, ma'am.
Okay.
Yeah.
Yes,
I'm
ma'am.
sorry for my ignorance. What I remember is you young girls, so enthusiastic, bubbling with energy. Wish you all the best.
Thank you so much, ma'am. It's an honor to have you on this platform, ma'am, and your words will be very well taken. And definitely, we will have more awareness programs regarding the same in the future years to come. If I and Supriya get elected for the same, ma'am.
You
Because
both
I'll be
should,
contesting
because
for
this is
public
a
awareness
very
and she'll be contesting for adolescents, ma'am. Preeti is for medical disorders.
Let me be honest, even I didn't know that this 8,000 people have been benefited. So it's such a good thing to be associated with your young people, young ideas.
Thank you, ma'am. Thank you, Supriya ma'am, for coordinating the entire program. And this is the 21st episode that we are doing. It is my privilege to introduce Dr. Sheila Mane, madam. She is currently the DNB faculty at KCG Hospital, Bangalore. She is the ICOG Governing Council member and the president-elect, the president of the Isopap Society of Bangalore, and the president of Bangalore Menopause Society. She has been more than 2 decades. Yes, ma'am.
I think we'll go ahead. Everybody
Yes,
knows me.
definitely.
And as Dr. Kiran
the stage
mentioned.
is all yours, ma'am.
Yeah. So thank you,
I give her
Dr.
introduction, best introduction in one line. She is queen of PPH.
Yes, ma'am.
Anyway, thank you. So now PPH has taken a back seat and hypertension is the first now. So we have to tackle that now. Yeah. So thank you for your kind words, Dr. Monica, Dr. Alka. I always appreciate your love for me. And Dr. Supriya, as you said, bubbly, ideal person for adolescent health. And I know Monica is doing a lot of work for with public awareness, and quietly she works. And Dr. Preeti also, we know that she's been working in Mumbai with Isopap as well as with Foxy also. I think she was involved in adolescent health with Dr. Suchitra also. So it is nice to see that all the youngsters are coming up and they are doing so much of work. And I think all innovative ideas come with young minds, and that is very, really nice to see. And this program itself speaks about that. In Bangalore also, we have this Smile Train in Maha Hospital. And there also regularly these surgeries happen. And I must tell you, even the international faculty is also invited sometime to operate. So many children are benefited. So today's program, as I mean, it is very important to diagnose it. I think that is very important, and the severity of it. So the way it is been framed, and the counseling, which plays a very important, because I have a patient recently, I mean, referred by somebody. And now this is done. We have to investigate her for other, as well as the counseling. Otherwise, somehow they go and get it terminated, okay, and they won't even tell. But now we know that it is not so easy. They have to take the permission of the medical board, because we have a MTP law. So all those things have come, because most of the time it gets detected later. So I really congratulate all of you, all the youngsters, all the young talent coming up with this program. And I know Dr. Ajit is going to talk about the ultrasound part of it, how to diagnose, I think, which is very important. I have asked all my postgraduates also to join, because sometimes, you face this situation, which I am facing right now. And then we should know how to counsel also. That plays a very important role. When I was a child, I still remember our neighbor's child had this problem, and definitely was diagnosed after birth, and he was operated in Nagpur Government Medical College. So there was a special ward for that. But yes, the parents, they really suffer. By the time it is diagnosed, feeding becomes a problem. So many things are there. So they really need proper support from the time the child is born, and then till the surgery is planned. So it's a very, very good initiative, and I wish all the best to all of you. And thank you for inviting me in AMOX program. Thank you, Dr. Kiran and Dr. Supriya, for inviting me and giving this opportunity to share my thoughts. Thank you.
Thank you, ma'am. Thank you so much for being with us today. I now hand over the proceedings to Dr. Preeti to carry forward the academic session.
Thank you. Thank you so much, Monica. I would like to first thank Kiran sir, Sheila madam, as well as Dr. Kriplani madam to be there to bless us all. And now, without wasting more time, let's start the program. I'd like to take the opportunity to first introduce our chairpersons for today. First, we have with us Dr. Mahesh Joshi. Dr. Mahesh Joshi is right now the president of the Thane OBGYN Society, and he is also the joint treasurer of the IMA, Maharashtra State, the past president of the IMA Thane branch, and is a medical director of the Manas Nursing Home at Thane. We also have with us Dr. Nanda. Dr. Nageshwari Nanda is right now the Secretary General of Thane OBGYN Society, a gold medalist in MD from Mysore Medical College, and the managing committee member of TOGS since last 2019. And she has been in practice since 2001. So a good 23 years of clinical work, and has been kind enough to join us today. We also have with us Dr. Vishwas. Dr. Vishwas Patulkar is right now he's an infertility specialist, and he's right now the treasurer of Navi Mumbai OBGYN Society, and been just elected as the secretary of the Navi Mumbai OBGYN Society. Has been doing reproductive medicine as well as practicing laparoscopy and endoscopic surgeries, and is also member of ISAR and FOXY since long. We also have with us Dr. Revati Rane. Dr. Revati Rane is again recently elected as the president of the Akluj OBGYN Society, and runs a fertility and a test to baby center. In addition to all her academic endeavors, she also has written a book. In fact, she has written multiple books, but something very interesting is that she has been the editor of the Navrangi Khana Khazana book, and has been also the co-editor of multiple books on infertility and IVF, has received multiple awards such as the award for social work, but also has won the Maharashtra MediQueen Season 2 award. So welcome our esteemed chairpersons, and can I please request Dr. Joshi to introduce our first speaker for today, Dr. Sujit. Harsha, can you please put the, Dr. Joshi, sir, can you please introduce us?
Mahesh, are you there?
He was there.
I think he's locked out.
Yeah, sir is not
Nageshwari
there.
is here. Yeah, Nageshwari
Yeah,
can do.
I'll introduce him.
Sure,
It'll be
sure.
my privilege to introduce Dr. Sujit Konkar. He has the formal USG training from Dr. Bimal Sahni's Sonoscan Center. He has done basic invasive procedures training from Dr. Khurana Sir's Apex Institute of Fetal and Reproductive Sciences. He is FMF certified for 11 to 13 week scan, PE screening, Doppler. He is Vice President of Society of Fetal Medicine, Marathwada chapter. Was past chairperson, Fetal Medicine Committee of MOX, and he is ICOG member. He's been the director Sri Hospital, which is a Foxy recognized sonography training center. He's interested in advanced fetal ultrasound and fetal interventions. I welcome you, Dr. Sujit. Please take over for the session.
Thank you, Dr. Nageshwari, for this nice introduction. May I share my screen now?
Sure. Dr. Mahesh sends his regrets. He just called up to say because of the there is some electricity outage because of the rains, and that's why he got locked out.
Good evening, respected seniors, dear friends and colleagues. At the outset, I would like to thank the organizers, especially Dr. Monica and Dr. Supriya for this event, for giving me this opportunity. So my talk is on imaging in cleft lip and cleft palate. So facial clefts by and large consist of two things, cleft lip and cleft palate. The complicated transverse cleft facial clefts are not included in this talk, and this talk is limited to only second trimester, not up to first trimester. So orofacial clefts, it is a failure to either completely merge or fuse in developing facial and palatal processes. Cleft lip is unilateral or bilateral opening in the upper lip between mouth and nose, while cleft palate is breach in the continuity of the palate. It is furrow in the palate. It is a birth defect characterized by opening in the roof of mouth caused by lack of tissue development. The incidence varies with different population. It is seen highly in Afghans. In India, the incidence is 1 in 700 equals to that of Downs and Talipes. The commonest combination is cleft lip with cleft palate, is seen in 45% of cases. Unilateral cleft palate is seen in 25% of cases. Isolated cleft palate is seen in 40% of cases. Isolated cleft lip seen more seen in males, while isolated cleft palate is more seen in females. And most of them, many times the cleft lip it is unilateral and most commonly seen on left side. It is in 80% of cases. Various etiological factors have been put forward, like heredity in the form of genetic predisposition and consanguinity, exposure to various drugs like antiepileptics and warfarin, alcohol, exposure to radiation, various infections, nutritional disturbances during development, defective vascular supply, drugs, tobacco smoking, tobacco products and smoking, and various syndromes. So what is the risk of chromosomal abnormalities in these situations? The median clefts almost all are associated with chromosomal abnormalities. Most of the times they are associated with holoprosencephaly, which is associated with trisomy 13. Bilateral cleft lip and cleft palate, they are seen in 50 to 30% cases are associated with chromosomal abnormalities, while isolated cleft lip, only 9% association is there. There may be some cardiac anomalies associated like 22q microdeletion or Chart syndrome. Micrognathia is the most common association, and more than 270 syndromes are associated with it, like Pierre-Robin, Stickler, and Treacher-Collins syndrome. Why are we worried about this cleft lip and cleft palate? Because the baby have many problems postnatally, like feeding difficulties, swallowing difficulties, nasal regurgitation, hearing difficulties, speech difficulties, and obviously cosmetic. So cleft lip and cleft palate is one of the most common birth defect that pose significant medical, psychological, social, and financial implication on the affected families. And prenatal diagnosis is very, very important for two aspects. Number one, we can plan the delivery in proper center for good care, and another thing which is important in counseling the parents, which part will be taken by Dr. Kodu after my talk. Now coming to anatomy, this is the famous nose-chin view of the face, which tells you about the nasolabial crease, philtrum, cupid's bow, upper lip, lateral commissure, vermeil border, and lower lip. So what is primary palate and what is secondary palate? Primary palate is a very small thing. It forms the 4 central incisors, 1, 2, 3, 4, and extend up to 4 mm incision. This part is only primary palate, and rest of this thing is secondary palate, which includes hard palate, soft palate, and uvula. More than 19 classification systems are available in relation to cleft lip and cleft palate. This is the oldest put by Brophy. published in 1990. Various phenotypic variations of cleft lip and cleft palate are available as shown in this figure. This is Nagpur classification, Davis and Ritchie classification, View classification, Leishal classification, Friedman's classification, Nyberg sonographic classification, but most widely used and accepted is this Kernhan's classification. Here, this facial area is divided into 9 parts, and any part which is affected is shaded into gray. For example, in this A, there is isolated left-sided cleft lip. So number 4 is shaded. Like that, this classification is done and very easy to understand for all the clinicians and for plastic surgeons also. Now, we'll not discuss much embryology. Just remember that the embryologic parts, they come from lateral part to medial part and fuse in the midline to form the upper lip. Very nicely shown in this picture. See this from laterally they come in the midline from the upper lip. This is not in the case of lower lip. So you never find any lip, any cleft lip in the lower lip. We discuss only upper lip. So this is in the 6th weeks. By 7th weeks they come in the midline. By 10th week they fuse. And one important thing about regarding the development of palate, the palatal fusion occurs by 9 to 10 weeks, but the ossification starts after 11 weeks. So sonographical comment on palate should be done after 11 to 12 weeks only. And presence of midline echo, that is visualization of the nasal septum, is indicative of cleft in secondary palate. We'll see after that. What does ISOC tell you about this? What does guideline tells? Look at the upper lip, nose and nostril in your routine second trimester anomaly scan to diagnose cleft lip. Remember here that we are not here, it is not mentioned about anything about cleft palate. So even if only you diagnose cleft lip, look at the lip and diagnose cleft lip is sufficient, more than sufficient. But examination of cleft palate is up to advanced stage. So this is a very good book, very basic book by Dr. Lakshmi Ravi Selvaraj. First time mid-trimester ultrasound diagnosis for facial clefts. Those candidates who are interested in imaging of cleft lip and cleft palate, they can go through this book. Many concept of my talk and many images are also taken from this book, from talk. So there are what are the basic evaluation of fetal planes? There are 3 basic planes. One is coronal plane, that is nose chin view. Axial plane, we get alveolar arch, and sagittal view. So these are the basic planes when we discuss about cleft lip and cleft palate in general. So this is the best view to access for cleft lip, that is nose chin view. You get to visualize this nose, philtrum, alloy of nose, upper lip, and this is also called as Cupid's bow. So what happens in unilateral cleft lip? It is the lateralized defect partitioning the soft tissue of upper lip into 2. And one characteristic thing here is the falling down nose. So this part of nose is looking to be dropping into this defect. Also look for the extent of midline involvement, especially in the philtrum, the central area. So in bilateral cleft lip, the soft tissue of upper lip will be partitioned into 3 components. Excess soft tissue mucosa under nostrils, which is the median process, as shown here in by arrow. And the median process is that which appears as the premaxillary protrusion in the mid-sagittal section, that is the upper part, and 2 clefts on either side of the median process. So one important thing to remember while imaging this thing is that there should be minimal fluid to delineate margin of upper lip, as shown here. This is the small stick of fluid, so that you should not miss subtle changes, subtle defects also. This is very subtle defect, which can be missed very easily, but because of this small amount of fluid, it is greatly picked up. 2 important things should be thought of. One is umbilical cord, second is part of hand. When you are suspecting cleft lip in this in any case, you can take help of umbilical color Doppler in these cases. In median cleft lip, it is a midline defect in the soft tissue mass of upper lip, and there is absence of median process with non-visualization of philtrum, as shown in these images. So this is the difference between bilateral versus median cleft lip. In bilateral cleft lip, you have median process, as shown here, while in median cleft lip, there is absence of median process. There is empty area in this central region. The presence of premaxillary protrusion is indicative of bilateral cleft lip. So this thing is shown nicely in these 2 images. So median cleft lip is almost all times associated with holoprosencephaly, that is trisomy 13. This is very nice case of holoprosencephaly. You can say this is a defect. This is depressed nasal beach, single ventricle, and is unfused thalami seen very nicely in this image. So you have diagnosed upper lip. You have seen upper lip, you have diagnosed the unilateral or bilateral cleft lip. But does your exam ends here? Is there any need for extended facial examination? Yes, there is need, because you have to look at the palate, because for that palate you need additional views. Once a cleft lip is detected, an extended examination of fetal face is necessary to access cleft extension into the palate. Moreover, this is very important when there is a history of a cleft lip or cleft palate in the family, in the relative, or in the friends, or any syndrome having cleft lip palate as a component. So you have to know the recurrence risk of this thing. So here it is very, very imperative to look at the cleft palate, look at the palate for clefts. So why it is difficult to diagnose or look at the palate? Because of few reasons. Because the palate is surrounded by osseous structures which shed shadowing. Again, it is dome shaped, it is not straight. And hard palate and soft palate, they are not in one plane. See, you can see this is premaxilla, and you can see this dark area. This is a lot of shadowing here. So palate lies here in this area. So you cannot comment anything about that because of this shadowing. This is the practical difficulty you face when you are looking at palate. So this is the palate in first trimester. See, this is straight line, it is easy job. But in second trimester, it is dome shaped. And see, if you look at the coronal view, you get only this visual. This much part of can be seen. If you get sagittal view, you may get this only this part of the palate. So you can't tell confidently that this palate is normal or not. It is related to this figure, because it is subjective. Every examiner, every ultrasound person doing will tell a different story about that. And another is the vomer. Vomer bone is lying just above the secondary palate, and that may complicate your findings. So if you look at this figure, you can see this premaxillary, this line, and by and large it looks very, very normal. But if you look carefully, this is the vomer bone, and the palatal line is not here. This is the case of cleft palate. This is a very beautiful article published in Ultrasound in Obstetrics and Gynecology. Absent superimposed line sign, that is a novel marker in early diagnosis of cleft of fetal secondary palate, especially in early pregnancy. This is the beautiful sagittal section of the fetal face, and here you can see this bifid-like structure. It is having three components. First is premaxilla, the upper line is vomer, and the lower line is palate. So when you see this structure, superimposed line, you are sure that you are less likely to miss out cleft palate. But what about second trimester? So there are some tips to evaluate secondary palate in second trimester. Number one, the fetal position. The neck should be in slight extension. It should not be flexed or neutral. Should be extension, so that the shadowing from premaxilla will not be here. Next is angle of insinuation should be 45 degree. See, this angle should be 45 degree. And most importantly, there should be some fluid in the oral cavity, so that the borders are very clearly seen, contrast is seen. So this is the normal palate. You can see the extension. Neck is in extended position. The angle is 45 degree, and see the beautiful fluid here telling you this is premaxilla, this is the hard palate, and this is secondary palate. You can see this equal to sign. This is bifid uvula very nicely. If you see this in your routine scan, you are ruling out cleft in secondary palate. Another indirect evidence is the equal sign. This is the level, just level below level of BPD plane. At the level of oropharynx, you can see these two echogenic lines, and this is because of uvula, echogenic uvula. And unremarkable uvula implies the presence of intact palate. If the uvula is deformed or absent, this might indicate defect in the palate. But there is again, uvula also look like vocal folds. There can be confusion. So you should be able to differentiate between these two, because uvula, these are smaller, very echogenic. Vocal folds are they are somewhat thicker, and they are seen on the cranial end. So this is the uvula, equal to sign. These are the vocal folds. So for your clarity, always include both of them in your section as shown in this video clip. This is the equal to sign of uvula, and this is the vocal folds. So you are not confused. What is this? It is clearly shown in this video clip that equal to sign is present. That means uvula is intact. So here, very nicely seen, equal to sign uvula, vocal cords. But in this image here, you are seeing only vocal cord, and the equal to sign of uvula is not seen here. You can there's suspicion of cleft palate can be there. Your alarm can be raised. Please remember that absence of equal to sign doesn't prove cleft palate. It is indicator for extended views. So what are these extended views? This is pre-maxillary triangle. So the tip is formed by nasal bone, maxillary process, and the base is formed by the palate. So this is normal, and you can see the base of triangle is not seen here. This is case of cleft palate. Then next is alveolar arch. It can be seen on the transfer axial section. This is beautiful alveolar arch view, and it is normal, and you can see the discontinuity in the region of alveolar arch. Again, bony posterior edge of palate. This is also seen just posterior to alveolar arch view, and this is a normal view, and this is the defect, large defect in the bony posterior edge of palate. Another thing is tongue. Even though there is a large defect in the palate, the tongue obscures the field. So you have to be patient, and you need to have some fluid in the oropharynx to delineate these structures very nicely. Real-time swelling of the fluid dynamics give you all the perfect results. This is the normal thing. You can see extension, 45-degree angle with beautiful palate seeing up to this bifid uvula. While in this case here, only tongue is seen. This is echogenic upper border of tongue, and you don't see any hard palate or soft palate or bifid uvula. This is diagnostic of the palate in the cleft secondary palate. These are the still images. You can see bifid uvula here. Nothing can be seen above the tongue. So how to access the lip cleft extension into unilateral cleft lip? See, here is, you have seen the cleft lip, then you have gone to this alveolar arch. There is defect in alveolar arch. Then premaxillary triangle, there is defect in premaxillary triangle that at the base, that means cleft lip also is there. And you see this sagittal view. There is no secondary palate can be seen. So this is the case of cleft lip with cleft palate. Now another case, this is unilateral cleft lip, but alveolar ridge is intact. That means this defect is limited only to lip, not going deeply. While here, unilateral cleft lip, but you can see the defect in the alveolar arch, but the base of triangle is intact. That means this cleft lip is limited only to, defect is only limited to alveolar ridge. So algorithmic approach should be adapted by the sonographers while looking at this. So the nose chin view is the basic view. Then you have to go to alveolar arch view, then go to premaxillary triangle, that is coronal view, then go to extended views, and the most important diagnostic view is the sagittal view. In case of bilateral cleft lip, this is example, bilateral cleft lip, bilateral cleft is alveolar ridge, premaxillary triangle, base is gone. So this is case of, in this sagittal section, you don't see any secondary palate. So this is the case of bilateral cleft with cleft palate. So this is the basic view. This is the diagnostic view when we need to diagnose fully 100% the defect in palate or secondary palates. What are the pitfalls in imaging secondary palates? Number one is shadowing from premaxilla, as shown here. This is, and number two is echogenic border of the tongue, upward border of the tongue. This can mimic the line of palate. So you have to examine it very nicely. So screening in low risk cases, these two views are very, very important and sufficient. That is nose chin view, and your equal to sign seen on the coronal section of the pharynx. But in high risk cases, you have to go for extended views like alveolar arch view, and the diagnostic view is this sagittal view. So last slide, you have to know the basic pains when you are looking at cleft lip and cleft palate. Fluid in oral cavity and avoiding shadowing from tongue and facial bones is very, very important. An unremarkable uvula visualized on ultrasonography as an equal sign suggests an intact normal secondary palate. And inclusions of signs proposed in sagittal, axial, and coronal planes helps in determining extent of clefts. Thank you for your patience listening. An appeal to all, as I am contesting for this post, chairperson for Genetic and Fetal Medicine Committee elections 2025. Thank you.
All the best, Dr. Sujit.
Thank you.
I
Thank
think
you.
we were wishing all bubbly ladies, and I think I must wish you also a great academician and wish you all the best. A nice presentation.
Very nice presentation, Dr. Sujit. I think it was really nice listening to this, and really good photographs and so much more to learn. I think we sitting in this thing, we never actually sit and look at so much of details of fetal medicine, and I think it's so important for us to sit and look at these plates and be aware, and I think we need to spread more and more of this awareness. And Doctor, I think Nanda, are you there? Would you want to
I'm
pass any?
there. In fact, I was really impressed with the pictures shown on the sonography. It was really beautiful. And I was really appreciating the lips, and it was so clearly seen, the cleft, the position, everything. And when it is seen, I think the counseling becomes very easy, and even properly taken to the action after the delivery. I think it was really great information, Dr. Sujit. Very nice presentation.
Thank you. Thank you.
Can I now please take the liberty to invite our next chairpersons? We have with us the Secretary of ACLUJ, Dr. Kavita Kamble. Dr. Kavita is the secretary right now of the ACLUJ OBGYN Society. She has been just elected as the same, practicing since last 15 years, mainly in high-risk obstetrics. And to one thing that I would like to add to her credit is Dr. Kamble has been the awardee of Mrs. Gorgeous in the Mediqueen Mrs. Maharashtra competition. And of course, she has been also the awardee of the Idol of Maharashtra from Sakal Samuha, and is also a Kathak dancer. Welcome, Dr. Kamble. We have with us also the Secretary of Satara Society, Dr. Kandare. Dr. Suryakumar Kandare is a laparoscopic surgeon and also has been trained in sexual medicine, as well as was working in the AMOGS as a high-risk committee chairperson, high-risk committee member, has been the past president of IMS Satara. We have with us the Secretary of Ichhal Karanji, Dr. Arushi Kajave. Dr. Arushi has been trained in laparoscopy and colposcopy, as well as in high-risk obstetrics, and is practicing since 2018 in the maternity hospital at Ichhal Karanji. Her special field of interest being infertility as well as cosmetic gynec and laparoscopy. So welcome all our esteemed chairperson, and can I please request you all to introduce our next speaker, Dr. Sonal Kadu. Do we have Dr. Kavita? Dr. Kavita, can you please introduce Dr. Sonal?
Yes, ma'am. Good evening, everyone. At the onset, I would wish all the contestants a very best wishes from ACLUJ OBGYN Society for the elections, and thank you for inviting me also as a chairperson. To introduce Dr. Sonal Kadu, Madam is in MD Medicine Clinical Psychological Master. She is a passionate advocate for holistic health, combining backgrounds in medicine and mental health. A very rare combination, I would say. She has lived experience as a cancer warrior deeply and informs empathetic and patient-centered care. She knows the integrity, compassion, and collaborative leadership in empowering individual teams. She is committed to creating meaningful, lasting connections in both clinical and community settings. This was the need of the hour, I think, because that's so nice of ma'am to introduce all these things. Also, she has been a head of programs at Sirat Cleft Foundation, an expert doctor for online freelance and jumping minds, providing remote psychological support and mental health consultation. She has previously worked with dentistry insiders at the medisaman.com and has managed research at post-traumatic.
Is it my network or is it Dr. Kavita's?
Dr. Kavita is still there. Yeah, I think
looking forward to your talk.
Thank you, Dr. Kavita. Dr. Sujit, that was a very well articulated PPT. Too much pressure on me. I will now share my screen. Please let me know if it is visible. Are you able to see the screen?
Yes, ma'am.
Is it presenting in full screen now? Is it presenting in full screen now?
Yes, yes.
All right. A very good evening, everyone. Thank you for the intro, Doc. I am hoping and praying that I step up to what Dr. Sujit has a very elaborate and very well articulated PPT. All the respected faculty and professionals of AMOGS and the dignitaries and representatives of Bajaj Finser and the phenomenal team of Smile Train India. It is an absolute privilege to be here with your esteemed company today. I'm Dr. Sonal Kadu. I am the head of programs at CEDAT Foundation. CEDAT is a community-led initiative focused on the holistic well-being of individuals born with cleft lip and palate. As proud partners with, is the next slide visible?
No,
Yes,
it's
ma'am. Yes, we can see the second slide.
Yeah. As proud partners with Smile Train India, we provide free, high-quality psychosocial care and counseling to cleft warriors and their families. I mean, all of us dream, everyone can dream, but when we dream as a team, when we dream as a community, weaving those dreams together into a cohesive whole is quite an art. Aligning hearts and hopes and visions into one meaningful tapestry, that's something special. When we begin building Seerat and articulating and shaping all the programs last year, especially the mental health programs, we stood at an edge of a dream, full of purpose, but aware of the challenges ahead. And just when we needed it the most, support found us wrapped in trust and belief. It came through our partners, the Smile Train India. They did not just offer help, they walked with us, they believed in us, and that belief made all the difference. This is the, since I head the programs, this is the programs that we have very well articulated. We offer, I hope my slides are available, visible, because I'm not able to see my face or anyone of you.
Yes, ma'am. We can see your
Yes.
slides.
All
We can
right,
see
all
the
right, all right. So at Seerat, we offer an ecosystem of holistic healing. It's a bio-psychosocial model. As the head of programs, I lead these programs, which are medical, surgical interventions, speech therapy, and mental health. Through our incredible partnership with Smile Train India, we have integrated psychosocial care into every stage of cleft journey, from feeding and lactation support to career counseling, all offered free of charge. Because we believe a scar on the lip should not scar the spirit. Today, I'm honored to share insights from our counseling support work at Seerat with Smile Train India, made possible through this powerful collaboration. Surgery fixes the lip and palate, counseling frees the smile. Without flouting any confidentiality here, without mentioning names of any of our patients or professionals, I did still love to share all the wonderful impact stories. And I'd like to begin with the story of a little warrior in Delhi. Just 1 year old, he had just recovered from his cleft surgery, but his parents were still struggling. Not with the stitches, but with the silence that followed later. Will he speak clearly? Will he be able to eat properly? And the most common question that I get asked is, Dr. Sonal, क्या हमारा बच्चा दूसरे बच्चों की तरह normal बनेगा? The scalpel had closed the gap in his palate, but the gap in the confidence was wider than ever. This is where counseling and community steps in. Because surgical excellences fixes the anatomy, but psychosocial support, counsel restores identity, self-esteem, and family resilience. Without the second half, the first half risks losing its benefits. Now, like Dr. Sujit said, each cleft warrior averages about 3 to 5 procedures before adulthood. During that time, they and their caregivers face persistent worry, feeding struggles, bullying, and self-image issues. And when these stressors go unaddressed, 28% of families discontinue care. So comprehensive care, cleft management marry surgical excellence with sustained psychosocial support and counseling. It is important to recognize that mental health challenges do not have one size fits for all. It needs shift with every stages of cleft journey. This is a mental health program, and we offer individual counseling, family counseling, and the buddy support. These are three main programs under the mental health program. And this is how this is exactly how we articulated and design our mental health program. The way a condition or event influences one individual or one family may vary widely from how it affects another, depending on their environment, resilience, resources, and relational dynamics. And we must, especially in India, we must stop assuming uniformity in how people suffer or survive. Mental health and the challenge that come with it land differently on different soldiers. And so my aim when I was articulating the mental health program at Seerath was to create a support system that is diverse and adaptable as people we are trying to serve. When Rahulji called me up to invite to speak at this webinar, I was really confused, and he told me that the audience, because he told me that the audience is OBGY professionals, and my immediate reaction was, Rahulji, I have studied general medicine and clinical psychology. Mera aur OBG ka dur dur tak koi samajh nahi hai. And then he said, no, it's about cleft care. And then like a sudden realization, it hit me that the whole journey of cleft is really from womb to the world. Let's zoom out for a moment. I'm sure I mean Dr. Sujit has already covered this, but India sees nearly 35,000 cleft births every year, one every 15 minutes. And about 60% of this are first detected in your care. All the esteemed OBGYs that are there were part of this webinar, either through scans, antenatal scans, or right at birth. Yet, fewer than 25% of families receive structured counseling, and that's a missed opportunity to change the trajectory of a child's life. You, everyone who's here today, are the first medical professionals to meet a child with cleft, sometimes while they are still in the utero, sometimes minutes after birth. And so today, I will highlight the reasons why structured counseling and community support are as indispensable to cleft care as the scalpel itself, and why they start in the antenatal stage. From antenatal detection to delivery to postnatal visits, every stage presents a unique emotional challenge and an opportunity as well. And your role is continuous, not episodic. This, I feel, is the we started our programs in September really, and this I feel is the missed window. You as OBGYs are storytellers, a guide, the one who speaks the first words when the family hears the word cleft. You're the first link in that safety net. You are not just the first to detect cleft, you're the first voice that the family hears, and the voice has incredible power. Like Dr. Sujit said, at the antenatal 18 to 24 weeks, parents made the word defect for the first time. Defect. A single scan image changes the family's narrative to a whole different level. When the image reveals a cleft lip or palate, the next word spoken by the OBGYs have more healing power than any suture material. We often underestimate the power, how powerful our words are. A single sentence from a professional can either deepen a parent's fear or plant seeds of resilience. As the distinguished professionals attending this webinar, you hold the power and often most trusted connection with the family. And so today I invite you to look beyond the operating list and see yourself as the architectures of a lifelong safety net woven from womb to the world. 3 simple sentences, it's common, it's fixable, and we have a team ready, can help transform their shock into a plan. Cleft is a difference that is correctable. Difference and correctable. It's just wordplay, but families remember these words forever. Let those words be full of hope. Let them be the first bricks in a bridge that leads fear to flourishing. In the stage of 0 to 2 years, we focus on parents, especially the mother, because that's where the distress often begins. At the time of diagnosis and the first surgery, many families experience deep guilt, anxiety, overwhelming stress around feeding. So our interventions include crisis counseling, lactation support, and very practical tools like demonstrating how a squeeze bottle works, how feeding techniques are, and connecting these parents with other parents who have walked that same path, or connecting them with our buddy support who are cleft warriors themselves and have that lived experience. So our goal is to create reassurance and restore a sense of agency early on. Our first counseling starts with maternal counseling. We often see infants whose surgeries get postponed because they are not gaining sufficient weight. The delay places considerable emotional strain on families, especially on the mothers. Not that we are royally ignoring the fathers, but mothers are the epicenter of all that stress. Hence, now, whenever we schedule a lactation or feeding consultation, we add a simultaneous family counseling slot and a tailored one-on-one session for a mother as well. It has really been a journey of learning and unlearning. I remember speaking to a mother who was in a lot of distress. We had just started our program, and she was in a lot of distress because the baby was not gaining weight. Every time she would go for a pre-op consultation, the surgeon would say, "अभी नहीं, अभी थोड़ी देर बाद थोड़ा वजन बढ़ने दीजिए, फिर आप आ जाइए." And this happened thrice. The first time this happened, the mother was okay. She called me up and said, "Dr. Sonal, वो बेबी का वजन नहीं बढ़ रहा है, तो अभी कुछ हफ्तों में वजन बढ़ जाएगा, तो उसके बाद सर्जरी करवा लेंगे." The second time this happened, the mother was borderline agitated. उनका फोन उठाते ही पता चल गया. There was no hello Dr. Sonal, नवी मुंबई में आपका मौसम कैसा है. She started with, ये क्या है मैम, हर वक्त हम इतना ट्रैवल करके जाते हैं, हर वक्त हमें वापस भेज देते हैं, कब देंगे सर्जरी का डेट, कब होगी सर्जरी. We were able to calm her down, gently assure her कि देर हो रही है, कोई बात नहीं. We explained her that the baby's palate was quite wide and the upcoming surgery would be a major one. That's why it's very important for the baby to reach a certain weight bracket to ensure a safe procedure and a smoother recovery. But then when it happened for the first time, नहीं आप थोड़ा और वजन बढ़ा के आओ, जब ये तीसरी बार हुआ, this time it really broke her spirit. The mother left the hospital carrying not just a baby but a heavy burden of guilt and self-blame. मेरा यहाँ बेवजह वजन बढ़ रहा है, मेरे बच्चे का क्यों नहीं बढ़ रहा है? That thought kept echoing in her mind so much. That evening, the mother, overwhelmed by stress and fear of her newborn, skipped dinner. The next day, she skipped both lunch and dinner. By day 3, the impact had rippled through the entire household. Because the mother was in distress and not eating, now her husband, the baby's father, stopped eating properly. Now my wife is not eating, how will I eat? This triggered anxiety in the baby's grandparents. They saw
किती वर्ष होतं का आपण
sorry?
पांढरं
रेंज तेवढी देणार आहे. Are you guys able to hear me? Hello?
Yes.
Was there some disturbance from my end or?
No.
Okay.
The disturbance on the other side. You can please continue.
All right. Yeah. Where was I? Yeah. So this is, I would like to show you a video of what happens when the mother and the father and the baby is interested. It's not just one phenomena. This is what happens. It creates a ripple effect. I hope everyone is able to see the video. Is the video visible?
Yes.
All right. So now the mother is in distress. Her partner, the father of the baby is in distress. The grandparents are like, हमारी तो इकलौती बच्ची है, वो इतनी स्ट्रेस में है, उसके पहले बच्चे के साथ ऐसा हो रहा है, हमने किसका क्या बिगाड़ा है? So the entire family is going through that ripple of depression. And how did we find out? Through a routine check-in call from one of our buddy support volunteers. A simple act of care, not prompted by complaint or crisis, just someone reaching out to ask, how are you doing? आज कैसे हो आप? That's when ये सब पता चला. When the buddy support called me up to update what's happening, I immediately scheduled a family counseling session and began individualized mental health counseling support for the mother. Within just a couple of weeks, not just did the infant begin gaining weight and made the growth targets required for the surgery, but the mother also reported significant emotional improvement. The entire family expressed feeling calmer, more supported, and better equipped to handle the journey ahead. Stories like this put a human face on a psychosocial outcome metrics, because behind every data on a maternal, family, and buddy support counseling is a real face, real family, real moment of pain, and with the right support, a real moment of healing. After maternal counseling, what we essentially provide is individual counseling. At Seerath, every community member, be it warrior or their families, they begin their intervention journey, their healing journey, or any program related call with a conversation with me, especially for the mental health program. So in every first session, I personally speak to each warrior to understand their unique story, their needs, their pace, their goals, whether they are navigating to anxiety, grief, trauma, they have identity issues, burnout, or they're simply seeking clarity and support. This initial conversation helps us see the whole person, not just the problem. Now, based on this understanding, I then connect them to the most appropriate mental health professionals from our team. For example, just last week, we had a mother called me up and saying that her 15-year-old is experiencing intense anxiety. She's from Maharashtra. The boy wasn't eating well. He has been isolating himself. And I received a call saying, "Ma'am, काहीच खात नाहीये, जेवतच नाहीये, गप्प गप्प राहतो, चिडचिड करतो." Now, the mother had attended a mental well-being webinar last year, Seerat's mental health webinar. And so she was very well psycho-educated. She knew there was something off with the kid. So, emotionally or mentally, something is off. But exactly क्या हुआ है, ये समझ नहीं पा रहे थे. When she tried asking him what's troubling him, he did not share anything. After speaking with him, I realized that the root of his distress was confusion about which career path to choose. Now, based on that, I connected him to a student and career counselor, someone trained to offer both emotional support and practical guidance. So at Seerat with Smile Train India, our therapist and counselor use evidence-based tools while always adapting to the warrior's lived experience. This ensures that every session is not only clinically effective, but also deeply relevant, respectful, and empowering. The third most important aspect of our counseling is the family counseling. As Geber Mate says, no two children have the same parents. I'm sure आपको भी किसी को पूछा तो you'll say कि हमारे भाई बहन को कोई अलग ट्रीटमेंट मिला था, हमें कोई अलग ट्रीटमेंट मिला था बचपन में. Gabo Mate is a Canadian physician who specializes in trauma, addiction, and stress. Even in the same household, each child experiences their parents differently and the world differently. And that is why we cannot assume, again, one size fits all approach to care, connection, or healing. That is why listening matters. Healing begins when we stop assuming sameness and start honoring individual truths. And that's exactly why at Seerat we offer tailored, personalized family and individual counseling. It's about meeting each person, each family exactly where they are, not where we want them to be. Often when we talk about mental health, we tend to focus on only that individual that is going through that mental health crisis. We often romanticize that idea, especially in India, especially in our country, we romanticize this idea that family should be the backbone. The family should be the unwavering support system for someone struggling with mental health or anything for that matter. Now, one person is unwell and the rest are supposed to support that person back to light. But families are made of human beings, each carrying their own fears, own fatigue, and sometimes even trauma. You never know. So when we expect them to be the light, we forget they might also be lost in the dark. This is why family counseling matters. It gives everyone a chance to speak, to heal, to understand each other. If I must put this in a very metaphorical way, one single drop of rain may nourish one seed while drown another. In much the same way, the weight of an experience or diagnosis can be carried very lightly by one family, while overwhelming another to another level. So we make sure that the journey of mental health in Cleft starts with the family counseling, maternal counseling, and we are with them throughout all stages of Cleft. I'd like to share an experience. We have a 19-year-old Cleft warrior from a very remote village in Uttar Pradesh. When I first received her SOS call, she was standing on a terrace ready to end her life. We obviously intervened immediately. After continuous counseling by a clinical psychologist, she was diagnosed with generalized anxiety disorder. She had lost her appetite, could not sleep properly, was experiencing frequent panic attacks. But happy to report that just last week she cracked her master's exams and now she's over the moon about moving to Delhi for higher studies. So through tailored one-on-one counseling and our buddy support programs, we were able to walk this journey with her from suicidal ideation to cracking master's exam. And we continue to do so. We were able to understand her mind, support her heart, hold her hand when things got wrong. But how do you explain all of this to her mother who's not educated? देहात से हैं, उनको कैसे mental health समझाए? How do you help a parent make sense of something as invisible as mental health? When I spoke to her, she's like, क्या हुआ है? अच्छी खासी तो है, खाती पीती रहती है, क्या कुछ नहीं हुआ उसे. So how do you explain that her daughter's tears aren't natak, they are symptoms? How do you explain that her not eating, her silence, her grumpiness isn't bematlab ke nakhre, it's distress? This is where our work goes beyond therapy. It is not just diagnosis, it is about building understanding in families, creating language for pain where none existed. They don't know about mental health. They are not psychoeducated. And helping them see mental health with same urgency and compassion as the body. It is about building and improving the interpersonal relationship with the family. A lot of time, like most of our parents, देहात से होते हैं, गांव से होते हैं. So how do you explain कि आपके बच्चे के साथ क्या हुआ है? This is one image I use to explain what is wrong if there's a high risk patient. So the example I gave right now, the mother is like, कुछ नहीं हुआ है, अच्छी तो है. And with this scanning image, this brain scanning, I was able to tell her this is a normal brain, and this is how a OCD brain looks like. This is how a bipolar brain looks like, and this is your daughter's brain image. This is the anatomical changes that is happening in the hypothalamus. उसकी बॉडी में चेंजेस हो रहे हैं, बस आपको दिख नहीं रहे. And the last most important part of our mental health program is the buddy support. At Seerath, we have created a safe, accessible space where Cleft warriors and their families can reach out for emotional support, not just during their therapy, but whenever they need it the most. This is where our buddy support programs comes in. These are trained mental health volunteers. The buddy support offers a lifeline for moments that cannot wait. Whether it is a mother seeking reassurance for a difficult diagnosis, a teenager struggling with teasing at school, or a young adult grappling with body image before college. Our buddy support volunteers are there to listen, support, and guide. It makes me exceptionally proud to share this, that we have a couple of buddy support volunteers who are mental health professionals and Cleft warriors both. So sometimes when the family really struggles to understand what is going on with the child, we connect them to these buddies who have been there, done that. They have the lived experience. We watch these warriors and family, we match this warriors and families by regional language. Kabhi there's someone calling from Gadchiroli who's not able to understand Hindi. तो उसको कैसे हिंदी speaking buddy support क्या समझाएंगे? So we match with someone who's speaking Marathi. We match them with the surgery stage, and the buddies then connect with them weekly, on a weekly basis, by phone, WhatsApp, Google Meet. Parents, I've seen report a reduction in distress score. Children see real life model who look like them and are absolutely thriving. That is such a boost. Some of these buddy support calls last 10 minutes. Some of them last an hour, sometimes more. Sometimes all of us, I'm sure, not just Cleft warriors, sometimes we just need someone to tell us, you are not alone. Simple sentence, but a very powerful thing. And that is exactly what our buddies are trained to provide: compassionate presence and timely support. If all our high-risk mental health warriors, we have Cleft warriors with bipolar disorder, with depression, mood disorder, anxiety, severe anxiety, all of these high-risk patients are assigned a dedicated buddy who checks on them on a weekly basis. For instance, we are currently counseling a young Cleft warrior diagnosed with bipolar disorder. And the warrior has a history of suicidal ideation, multiple attempts as well. They have a qualified mental health expert assigned. They have an assistant mental health expert assigned. And then they also have a buddy support. Because what happens on the days when the expert is not available? What if I am not available either? What if none of our teammates are available? That was the reality that gave birth to this program. I'll be very honest, buddy support model was born out of necessity. It was simply not humanly possible for me or even our trained counselors, therapists to be available 24/7. But mental health crises don't wait for appointments, and our warriors deserve to have someone to reach out to in real time. And that is how the buddy support was articulated. That is why we have trained group of empathetic, deeply committed volunteers to step into that gap to offer active listening, emotional validation, crisis support, and de-escalation, and above all, a calm, non-judgmental presence in tough moments. Buddy support programs ensures no cry for help goes unheard. It is our way of saying you are not alone. Someone is always there. Someone is there to care for you deeply. At Seerath, we believe that mental health support should be proactive, it should be compassionate, and always within reach. And the Buddy Support Program is a living, breathing example of that belief in action. It takes a village to close a cleft. Whether it is family, community, or world at large, the idea remains, how can we come together? All of us who are here today, how can we come together? How can we listen better, care louder, and move as one? Because real change is always a collective act. And now to the most important slide of all. Okay, the important slides comes later. These are some of the testimonials. The first one is from the warrior who had suicidal tendencies. The other one is from the bipolar disorder. So I get to see the impact we create every single day because I get to talk to them every single day. Now to the important slide. I have spent the last few minutes discussing how vital counseling is for Cleft warriors and for the patients in general. The same principle applies to all of us, the professionals. Let me turn the mirror for a moment. In 2024 IMA survey, 45% of Indian OBGYs screened positive for burnout. This is an occupational hazard, not a personal flaw. Are we looking after our own mental health? When was the last time, Sujit sir, when was the last time you took a day off? Do you sleep 6 hours a day? I'm sure everyone who's attending this webinar has traveled by plane. I'm sure sabne हवाई जहाज से travel किया है. When you enter the हवाई जहाज and the plane is about to take off, what does the हवाई सुंदरी say? आपातकालीन परिस्थितियों में पहले अपना ऑक्सीजन मास्क लगाइए, फिर दूसरों को लगाइए. Put your own oxygen mask first and then to others. Self-care isn't selfish, especially for professionals. It's survival. It's not selfish. तो जब आपके पेशेंट्स आपके क्लिनिक्स में आ रहे हैं, आपके हॉस्पिटल्स में आ रहे हैं एंड वो पैनिक हो रहे हैं, व्हाट डू यू से? अरे रिलैक्स, कूल डाउन, लंबी सांस लो. तो आज आई वांट टू आस्क, व्हेन वाज द लंबी सांस you took? The professionals that are here today, when did you relax and cool down and took that lambi saas? So this is when we are caring for others. This is equally important with our mental health program as well. I check on our mental health experts on a daily basis. I make sure they are also seeking help when it is needed. And yeah, I have officially come to the end of the presentation. Just one second. Thank you for your time and energy and attention. This is our mascot, by the way, the Cleft warrior mascot, and this is our barking manager Bhavanda. We work in a online setting on Gather, and this is our office dog. This is Seerat's QR code to stay connected or to join our support system. Thank you for inviting me here today to speak about what I absolutely love to do. I look forward to your insights and collaborative ideas. Thank you very much.
Thank you so much, Sonal ma'am. That was a fantastic, really
Please call me
presentation.
Sonal.
Really eye-opening for us. Would the chairpersons like to make a comment?
Yeah, indeed. I would like to say most of the one-liners were like take-home messages. Simple things like the scar on the lip should not be a scar on the spirits. That was wonderful because as gynecologists, as obstetricians, when we first make the announcement to the patient what they want, and like as mothers, they want their babies to be the best. No, so they don't want even a cleft lip or a cleft palate to announce to them. It's such a big deal. So, like most of the times, they usually want not to continue the pregnancy. But this lecture would be, and this all these things like the counseling and making them aware of the situation. The word defect itself becomes so difficult to be announced to the patient. So it was really an eye opening for all of us also. And the like even for our own mental health, as you said, lambi saans kab li hai. So that was really an eye opener, and we
Everyone
really
who's
need
here
to take.
today Everyone who's
Yes,
here
that
today
was a nice.
should prescribe
Thank.
yourself a lambi saas, probably a weekend off. And
Yeah, thank you so much, Sonal ma'am. It was really
Please
a
call me
wonderful
Sonal.
lecture.
Thank you.
Yeah, such a wonderful lecture. Thank you for your counseling lectures for as obstetricians also. Thank you so much.
I think it was a fantastic talk and a real eye-opener. And I think what you said, Dr. Sonal, that we need to wear our own mask first, so our own mental health has to be taken care of first. with before everybody else. Only if we are happy and we are mentally at peace, we'll be able to help the rest. And that's such a wonderful thing. I must thank and congratulate Amogs for taking up this wonderful initiative, and Monica and Supriya, thank you so much for letting me be a part of this with being an MOC. And Monica, would you like to say something?
Actually, Preeti, there are some questions. If you don't mind, can I quickly take
Yes,
them?
yes, Supriya ma'am.
Yeah. So, Sujit, the first question to you is, are there any risks associated with fetal MRI during pregnancy?
No risk. Nowadays, fetal MRI is getting more and more involvement in diagnosis of the prenatal conditions. There is
Next
no.
question is, can MRI detect cleft palate when ultrasound fails to do so? And what are the limitations of using ultrasound for diagnosing cleft lip, cleft palate?
The limitations about cleft lip, there are no limitations of cleft lip. Cleft lip is very difficult to miss out actually. Cleft lip is very easy to diagnose. But the problem is with isolated cleft palate, because it
Okay.
is the structure which is inside the oral cavity. It is not in a line, it is dome shaped. So hard palate and soft palate, they are not in single line. So the view which I told that the neck should be at 45 degrees, extended neck, 45-degree angle and fluid in oropharynx, that will visualize beautifully the whole secondary palate.
Okay. Next question is for Sonal. What specific topic should be addressed during the first counseling session with parents?
It's really a different case scenario. Like I said, one size fits all does not work like that. It's a very personalized journey for everyone. For example, we have two new mothers with cleft diagnosis, but one mother is only worried about will my baby be okay? Will she look okay? But the other one is like, will she eat properly? Will she speak properly? So the intervention, the counseling really is a very personalized journey. But what we essentially start with is lactation and feeding, because that's where all the stressors start from. Bacha kha nahi raha hai, I don't know how to feed the baby's throwing up. So feeding, lactation, and then a personalized session for mother, and then family counseling, because it is equally, like I said, equally important for the father to understand what's happening, for the grandparents. Sometimes I end up speaking to fufaji, chachaji, atyaji, everyone. Like I'm taking a Google Meet and suddenly 11 people are there, Gorakhpur se, and I'm counseling everyone. So yeah, it's a very personalized counseling session for everyone.
Sonal, that is the story of our life for all obstetricians.
Yes, yes.
Moment you write LSCS, Fufaji, Chachaji ke Fufaji also turn up.
I know, ma'am. After every intervention, every counseling session, I pick up the dialects. So yesterday I was speaking in Kashmiri Hindi. Today I was speaking in Bihari, and my teammate is like, "किससे बात किया आपने?" Because that is the amount of time I invest in counseling. I also start speaking like them.
Okay, there's one more question. How can healthcare providers ensure culturally sensitive counseling? And one question is, what psychological challenges might individuals with cleft lip, cleft palate face during adolescence and adulthood?
The most important one in adolescence is their body image. This is when they start dating, and most of our counseling is around adolescence, because like I said, hormones are at peak. They think they are rebelling against the world. Nobody is able to understand me. Nobody loves me. ये आपने कुछ करा है इसलिए मुझे ऐसा हुआ है. So a lot of counseling group bracket is adolescent, related to body image only. And like I mentioned a few minutes ago, career counseling. They're really, sometimes when they take gaps for surgeries, they're really bogged down with, अरे हमारे classmates तो आगे चले गए, अब हमारा क्या होगा? So yeah, those things, career and look, and yeah, dating, relationships. I'm sorry, I missed the other question.
Culturally sensitive. How can we give culturally sensitive counseling?
Can you articulate that further? I'm not sure.
I absolutely have no clue. These are questions come
It's
from
very
the
big question.
Even I can't really pinpoint on what exactly the question is to be asked. But this has come from the delegates, so I really cannot elaborate on that.
All right. To give a brief idea, like I said, we match with the regional language, the cultural background, as well as someone who's from a very remote area in Gorakhpur would not understand a counselor, an elite counselor in Mumbai. They won't resonate to that idea. So we have counselors who understand the cultural difference, the regional language difference, the background that they come in. So I think that is
I
how.
think that's a very valid point.
Yeah.
Very valid point. Yeah, thank you. So over to Monica if she wants to make any comments, and then I think we can wind up.
Thank you, Supriya ma'am, and thank you, Dr. Preeti, for taking all the brag on your shoulders today, because I have been literally only present for the webinar today. Thank you so much for conducting it so well. Thank you, Dr. Sonal and Dr. Sujit, for accepting our invitation as faculty for today, and we have done an excellent job. And I think we have made the point very, very clear that cleft lip and cleft palate is not a taboo to continue the pregnancy. And we as Amoxians and Foxians would definitely raise the bar in counseling after listening to Dr. Sonal's talk. Thank you all our chairpersons, Dr. Vishwas sir, Dr. Kavita ma'am, Dr. Arushi, Dr. Mahesh and Dr. Nanda for chairing the session. Kiran sir, Alka ma'am and Sheila ma'am, thank you for accepting our invitation for the inauguration function. Harsha, thank you for all the technical help, the flyer, the delegate links. And last but not the least, thank you Smile Train for partnering with Amox and my pillars of strength, Dr. Preeti and Dr. Supriya. Thank you so much.
Thank you, Monica.
Thank you, ma'am.
You were present for the webinar. You did most of the background work, suggesting the speakers, suggesting the society. So your contribution is immense. Thank you so much.
I mean, she's the pillar of the Smile program. So, Monica, kudos to you.
I had taken an excuse today, ma'am, just.
Yeah.
So otherwise, Supriya madam is always there at the back end for helping me out with this.
Okay, thank you so
Thank
much.
you, everyone. Have a great day.
Okay, all the best, Dr. Sujit also.
Same to you, same to you.
Best to Sujit, Preeti.
All the best to all of us. All the best to all of
All
us.
the best to all of us, yes, sir.
Okay,
Okay,
thanks.
sir.
Take
Thank you,
care.
sir.
Great evening.
Thank you, ma'am.
Bye. Bye.